Welcome to the UnityPoint Health Meritor OB Services Preoperative Education class. This video is being brought to you by UnityPoint Health Meritor, their partners UW Health, and the practices that provide obstetric care at Meritor Hospital. You are watching this video because you will be having a cesarean birth, which is a surgery. We want you to know what to expect. We want you to learn about your care before and after surgery, including what problems may develop, when you should call if you have concerns, and to answer any questions you may have about the cesarean surgery. While watching this video, you will learn how to prepare for your surgery, what a cesarean surgery is like, about your recovery after surgery, what warning signs to look for, and who to call if you need help. Please remember this education does not take the place of your preoperative conversation with your care provider. You may watch this video again and pause it whenever needed to take a break or write down questions for your provider. In order to prepare you for surgery, we ask you to do a couple things. We ask that you attend a preoperative appointment to ensure all your questions get answered ahead of time. Write down questions before your appointment so you can ask your doctor and discuss any concerns you may have. We also ask that you make sure all the items you need are packed and ready to go. Leave jewelry and other valuables at home. If you do bring items, they will be placed in a bag for safekeeping. But remember, it is always safer to leave them at home. There are also some dietary and personal care instructions that are important to follow before coming in for surgery, which we will cover in this video. The night before your scheduled surgery, you should eat and drink normally up to 8 hours before your surgery. This means you can plan to eat a normal evening meal, but should stop eating at least 8 hours before you arrive at the hospital. Please review the times listed in the guide to your cesarean birth the nurse provided. Avoid eating heavy, greasy, or spicy foods that can upset your stomach and may be more difficult to digest. It is important that your body is clean for surgery to avoid the risk of infection. Shower as you normally would, but do not use lotions, perfumes, deodorants, and other products after you shower. You will be given cleaning wipes to use on your body after you shower the night before your surgery. Follow the instructions provided to you in the cesarean delivery patient information packet. We will talk more about how to use the wipes on the next slide. Use the cleaning wipes given to you at your appointment and in the order directed. Use a clean wipe for each of the 6 body areas. First, wipe your torso, avoiding the breast area. Next, wipe your arms, front and back. After that, wipe your back. You may need help from a support person for this. Next, wipe the area on the front of your body below your belly button down to your pubic hairline. Wipe across the whole area left to right. Avoid wiping your genital area. Next, wipe your legs front and back. Then wipe your bottom, avoiding the rectal area. Use a new wipe for each of the 6 areas. Remember to wear clean pajamas for bed and to sleep in clean sheets. Important! Remember, do not wipe your face, ears, nose, mouth, or breasts, and do not shower the morning of your surgery. It is important to read the instructions provided carefully and follow them exactly. This helps avoid unnecessary complications or delays. If you are on blood thinning medication, ask your doctor when to stop taking it before surgery. If you're not certain whether you're on blood thinning medication, ask your doctor during your pre-operative appointment. On the day of surgery, you can eat or drink items considered clear liquids. Clear liquids are drinks and food items that you can see through. For example, water, apple juice with no pulp, clear broth, jello or gelatin, popsicles, and black coffee or tea with no sweetener or cream. You should avoid any items that you cannot see through or that contain pulp, particles, or solids like smoothies, orange juice, dairy products like milk, yogurt, and ice cream, and coffee or tea drinks with added creamers or sweeteners. On the day of surgery, you cannot eat as you normally would. Eating too close to the time of your cesarean can require your surgery to be delayed or canceled. Up to 8 hours prior to your surgery, you can eat your regular diet. But up to 6 hours before your surgery, you can only eat dry white toast with no seeds or nuts. Do not add butters, jams, or other toppings, or eat meat, eggs, or cheese. You may ask, why can I only have clear liquids and dry toast 6 hours before my surgery? The less you have in your stomach before surgery, the less chance of vomiting during the surgical procedure. During surgery, the food in your stomach may pass into your lungs. This can be a serious and even life-threatening situation. Please follow your instructions carefully. This will keep you as safe as possible throughout your surgery and recovery. This medical image on the slide shows how food can pass into the lungs. On the day of your cesarean, we ask that you arrive at the hospital 2.5 hours before your scheduled surgery. You can find this time listed in the Guide to Your Cesarean Birth. The examples on this slide may help you understand when you should arrive. In the first example, you see a 7:45 a.m. scheduled cesarean. If that was the time of your surgery, you would plan to arrive 2.5 hours before that, which is 5:15 a.m. If you still feel confused about what time you should be at the hospital to check in, please look at the time noted in the Guide to Your Cesarean or ask your nurse or doctor. You may be asked to arrive even earlier for your surgery. Your care provider will tell you if this is the case for you. You may ask, why do I need to arrive 2.5 hours early? There are several steps you need to complete before surgery. I will give you a brief overview now, then discuss these in more detail later. You will have your blood drawn for lab testing. You will be given a pre-surgery drink. You will meet with the anesthesiologist. This is the doctor who will be providing pain control during your surgery. You will meet your surgeon and operating room team. This may include your surgeon, nurses, resident physicians, and surgical technicians. You've arrived! Welcome to UnityPoint Health Meriter Hospital. Once at the hospital, seen on this slide, you will park in the ramp shown on the left. You will enter the hospital from the parking ramp on floor 2. A staff person in the lobby will help you with your arrival and direct you to OB triage. You will check in at OB triage, located in the north wing. View the map on this slide to become more familiar with the hospital layout. The lobby is directly off the main entrance and the entrance from the parking ramp. Triage is on the main floor, which is floor 2, between the north wing elevators and the Center for Perinatal Care. When in doubt, ask. If you're not sure what to do, a staff member will always be available to help. Once you are checked in, you will begin your pre-operative procedures, or steps we need to help you complete before your cesarean surgery. The first, if you remember, is the blood draw. We take a complete blood count to see if you have anemia. Having anemia can increase the need for additional procedures. Knowing you have anemia ahead of time helps your surgical team prepare for any additional needs. We type and screen your blood. This is important for matching your blood just in case you should need a blood transfusion. We screen your blood for glucose levels. If your blood glucose is too high, this can be a risk for infection. We may need to give you insulin to lower your blood glucose and reduce the risk of infection. After your blood draw is complete, you will be provided with a sweet, fruity pre-surgery drink to enjoy that helps with your post-operative recovery. You will be asked to drink this after your blood glucose check, but more than 2 hours before your cesarean surgery. This is one of the reasons we have you arrive early. It can help reduce nausea and vomiting after surgery and help reduce blood sugar problems that could complicate your surgery and recovery, and help stimulate your digestion, which can reduce recovery time and your stay in the hospital. Remember, this is a special clear drink that will be provided at the hospital. Please do not drink any other types of Ensure or nutritional supplements before arriving. There are some steps we need to complete as we prepare you for your cesarean birth. You will be given a hairnet to wear. The hair on and around the incision site will be clipped close to the skin. Your abdomen will be cleaned with the wipes again, just like the wipes you used at home. In preparation for your surgery, your doctor will have gone over what medications to continue and which to discontinue taking. There are medications you will be given as part of your pre-surgical preparation. You will receive medicine to reduce stomach acid, nausea, and vomiting. You will also receive antibiotics to reduce the risk of infection. You may receive other medications and instructions from your OB care provider or care team throughout your stay and as you transition home. Always follow your care provider's instructions regarding medications. If you're not sure why a medication has been prescribed for you, ask. In preparation for delivery on the day of surgery, we will bring you to an operating room on the 4th floor. These operating rooms are just off our labor and delivery area in our birthing center. The nurses will help your support person put on scrubs and a hairnet or cap. You will be given anesthesia for pain control during surgery. It is normal to feel pulling, tugging, or pressure sensations during surgery. The surgical team will cover you with sterile cloths and draping to protect the surgical area and prevent you from seeing the surgery. Your support person will be escorted into the operating room once everything is ready. Your support person will be seated next to you so they can support you during the delivery. If your support person is not comfortable being in the OR, it may be best for them to meet you in recovery after your surgery. In most cases, the medication used for your cesarean will leave you awake but numb from around mid-chest on down. This is called a spinal. Medication is injected into your lower back below the spinal cord. As you can see by the image, the placement site is away from the baby and below where the spinal cord ends. The top image is showing you the spinal or epidural site and how you would be positioned for their placement. The site is in the low back below where the spinal cord ends, so there is almost no chance of injuring the spinal cord. The anesthesiologist will clean your back with an antiseptic solution before numbing the area with pain medication. You will feel a slight burning or stinging sensation while the numbing medication is injected. After the area has been cleaned and numbed, they will inject a test dose of medication. This ensures your safety. Next, they will use a small spinal needle to administer the spinal anesthetic, which provides a full block or pain control for your surgery. An epidural can be used for cesarean deliveries. If an epidural is used, a small flexible catheter delivers the medication. If you have an epidural already placed, the anesthesiologist will add a dose of medication to increase the pain control for the cesarean delivery. Sometimes the anesthesiologist will use a method called a combined spinal epidural. In that case, the anesthesiologist places an epidural port in the back. They inject spinal medication in the back through that port, then remove the spinal needle and place an epidural catheter in the back. The epidural will provide a continuous flow of medication. This can be helpful if your provider thinks surgery could take longer than average. This may happen for several reasons. For example, if there is a lot of scar tissue from prior cesarean deliveries. The medication provided in your spinal for a cesarean delivery has a small dose of morphine in it to help relieve pain for the first 24 hours. The medication may have side effects, which could include itching and nausea, which can be relieved with medication, or, on rare occasions, slowed breathing, which is dangerous. But your anesthesiologist will watch your vital signs very closely to keep you safe. In emergency situations or special cases, general anesthesia is used. This means putting you to sleep for the procedure and using a tube to help you breathe. In cases where general anesthesia is needed, your support person will not be able to be in the OR with you. They would be able to meet your baby and visit you in recovery. In some cases, your provider may offer to inject pain medication around the surgical site or near the nerves in the abdomen. This is called a tap block. This can reduce nerve sensations and assist with pain. In the operating room, you will have many people taking care of you. It may seem busy, but everyone has a job to do. They will monitor your vitals, blood pressure, oxygen, and heart rate. If you need anything, please ask. The whole team is here for you. For surgery, you will be lying on your back with your arms stretched out. A blue drape, like the one I mentioned earlier, will cover your belly so you won't see the surgery. Remember, although your belly will be numb from the medication, you will feel tugging and pushing. This is a normal part of the delivery. If you should feel sick to your stomach, please let us know. We can give you medication to help. If you feel cold, we have warm or hot air blankets to make you more comfortable. Remember, tell your anesthesiologist how you're feeling so they can help. On this slide, you can see the position you will be in during the cesarean delivery. The bear hugger mentioned above is a blanket that inflates with hot air across your arms and chest and may be recommended by your provider to keep you warm. Many patients ask about delayed cord clamping. This is a standard practice at Meriter Hospital that allows your baby to receive extra blood that can help baby's health after delivery. This means that we wait a little longer before we clamp and cut the cord. The extra blood baby receives during this time increases baby's blood volume, increases the amount of iron in baby's blood, decreases the chance of baby getting anemia or having less red blood cells. Delaying cord clamping when appropriate can help reduce the risk that your baby may need extra care after birth. Another really great way to help your baby after birth is holding your baby skin to skin as soon as you can. You can hold your baby skin to skin if you and baby are stable. Holding baby skin to skin helps regulate their body temperature, blood sugar levels, and heart rate. It also assists with bonding and breastfeeding. If you're not able to hold your baby skin to skin, having a partner, spouse, or other loved one hold baby skin to skin is a great alternative. After delivery, you will go to the recovery room for 2 to 4 hours. There you will be able to hold and feed your baby and have your support person with you. Next, you will be moved to your postpartum room. Your support person can stay with you, and your baby will stay with you unless they need extra care. If your baby needs to go to our NICU, the Neonatal Intensive Care Unit, your provider will talk to you about it. It can be hard to know how you will feel after surgery because each person is different. Here are some basics about what you can expect. You will have some pain. This is normal after surgery. Your care team will manage the pain and make sure it is not excessive or dangerous. You will be tired for many reasons, like the lack of sleep during late pregnancy or the anticipation of surgery, from the surgery, or medications used during the surgery, or from the baby waking you at night. You may feel weak, which is normal after surgery. You will still have some numbness from the medication. For that reason, it is important that you have help the first few times you get out of bed. You may feel an urge to go to the bathroom, but having a bowel movement may be difficult for several reasons after delivery. Some of the medications used can make your digestion sluggish, cause constipation, or your stomach to slow. If that's the case, there are some treatments that can help. You may also be slightly dehydrated. We will encourage you to drink water as soon as you are able. You will have vaginal bleeding. Vaginal bleeding is a part of the birthing experience whether you have a vaginal birth or a cesarean delivery. If you feel that you are bleeding too much, let your nurse know. You may feel queasy or have low or no appetite. This is common after surgery, but if it continues, talk to your care team about it. Our goal is to help you feel the best you can after surgery. If you feel uncomfortable for any reason, let your care team know. The Foley catheter or tube in your bladder will stay in for about 4 to 6 hours after the surgery. Your nurse will remove the tube about 4 hours after you get to your postpartum room. That is the room you will stay in after baby is born. Your nurse will help you get up out of bed and go to the bathroom or sit in a chair after your Foley catheter has been removed. Remember, there can still be some slight numbness, so you should not try to get up on your own for several hours. If you feel you're ready to get up, call the nurse to help. We want to help you get up and move around as soon as you feel ready. There are many ways to manage your pain after delivery. After delivery, you may experience low backache, sometimes caused by the uterus contracting after delivery. Uterine cramping as the uterus returns to its normal size. You may notice that discomfort increases with breastfeeding. That's because breastfeeding promotes the healing process by encouraging uterine contractions. Pain from the incision. This may be tenderness, soreness, or burning. A strong urge to pee due to the catheter in your bladder during or just after surgery. You may also experience bladder spasms for the same reason. Please let us know how you are feeling so we can help. We can provide over-the-counter pain medications. These are the safest and have the fewest side effects. We schedule these medications around the clock to reduce your pain. Acetaminophen and ibuprofen every 6 hours. This works well for many patients. Every patient is different. Some will experience more pain than others. We consider how each patient feels. Some patients may experience severe pain that may need additional treatments. For those patients, we may provide IV pain medication or pain pills prescribed by their doctor. These are typically opioid or narcotic pain medications. These types of medications can slow your recovery. On the next slide, you will see an example of a typical pain medication schedule. As you can see on this slide, we would typically continue around the clock with the over-the-counter acetaminophen and ibuprofen on 6-hour intervals, but can include a narcotic or opioid pain medication if needed to assist with pain. We use narcotic or opioid medications as a last resort. There are several other ways to make you feel more comfortable after surgery. Heating pads, warm packs, or ice packs can help ease discomfort. If you choose to use a heating pad at home, please make sure there is something between you and the heating pad. Don't fall asleep with the heating pad on or under you. Make sure you check the heat setting to avoid burns. Ice packs can also burn the skin if they are too cold or left on for too long. Limit the time you use heating and cooling packs to about 15 to 20 minutes for safety reasons. Do activities that take your mind off the discomfort and increase emotional well-being. Some examples are holding your baby, feeding your baby, short walks, spending time with your support person, or doing something you enjoy like reading, watching a show, or playing a game. Make sure you take time to rest in between. As you get back to your normal activities, pay close attention to how your body feels. Your body will let you know if you are doing too much too quickly. Movement helps the body recover and improves muscle tone and digestion. Slow down if you have increased pain or bleeding with activity, or you are feeling exhausted, especially if you feel you cannot care for yourself or baby. Always contact your care provider in the days and weeks after surgery if you feel something is not right. Go slow, but get up and go. Patients often ask, what can I eat and drink after surgery? We will encourage you to suck on ice chips or drink water within 60 minutes of arriving in the recovery area. After arriving to your postpartum room, we encourage you to eat what you normally would. Your nurses will help you order food. We also encourage you to chew gum soon after the operation is complete. Plan to chew gum several times a day, about 3 to 6 times daily, for between 15 and 60 minutes. This can help activate your digestive system after an abdominal surgery like a cesarean. Plan to bring a few packs of gum that you like. After surgery, it is very important that you get up and get moving. Being mobile in the hours and days after your surgery can help activate your digestion, increase muscle tone, improve bowel function, prevent blood clots, and prevent pneumonia, which is fluid buildup in the lungs. You can walk up to 3 miles on a flat surface every day, but listen to what your body is telling you. If 3 miles feels like too much, or you notice the warning signs mentioned previously, limit movement to what feels right for you. Remember, go slow, but get up and go. Some people ask, is my activity restricted after surgery? The short answer is yes, you will have some restrictions. These restrictions are in place to prevent you from re-injuring your body by causing stress to the uterus, the uterine muscles, abdominal core, and organs until you have healed. We do not want you to be operating machinery or driving a vehicle while on any narcotic or opioid medication. This is very dangerous. Other limitations include no lifting, pushing, or pulling more than 10 pounds or about a gallon of milk for the first 6 weeks or until your provider says you can. No engaging your core. Your core consists of the muscles and structures supporting the central part of your body, diaphragm, and pelvis. If you have exercises you feel you must do after surgery, please make sure these are approved by your provider. Otherwise, don't do it. Everyone can use the stairs unless you have a specific condition that prevents you from doing so. Just take it easy. For the first couple weeks after surgery, you should not drive. Here are some quick guidelines. Do not drive while on any narcotics or opioid medications. These medications can make you less alert or sleepy, making driving dangerous. And do not drive if pressing on the brakes is uncomfortable. This is dangerous and may slow the healing process. You can return to driving when you are no longer taking any narcotic or opioid pain medications, and you can use the brakes safely without discomfort. This usually happens 1 to 2 weeks after surgery. Note, if you are not certain what medicines are considered opioids or narcotics, ask your provider. Caring for your incision is an important part of keeping you healthy after surgery. Follow your care team's instructions. In the next couple slides, we will cover the basics about incision care. While in the hospital, you will have a bandage over your incision to protect the area. The bandage will be removed around 48 hours after your surgery. The bandage will only be removed sooner if there are concerns, such as bleeding. Please let your nurse know if you see bleeding from your incision or if the bandage falls off. Do not remove the bandage on your own. You may have steri strips or incision-safe glue to help close your incision. If you have steri strips or small bandages that go across the incision, leave them on until they fall off. Do not pick at them or peel them off. If you have incision-safe glue, it will just flake off on its own. Do not pick at the glue. We will give you sanitizing soap to clean your incision. You can shower and let the soapy water wash over the incision area, but do not scrub the incision site. When you dry off, only pat the area dry or use a hair dryer on the cool setting to dry your incision. In some cases, special incision care is needed. If you need this, your care team will go over instructions with you on how to care for your incision properly. Interdry is a special fabric that helps to keep the skin dry in certain areas. It helps to wick or move moisture away from your incision during healing to help prevent infection, bacterial growth, and inflammation or swelling. Another special treatment is a wound vac. A wound vac helps to promote healing. If a wound vac becomes part of your recovery plan, it will remain in place until discharge or about 1 week after your surgery. Your provider will discuss your exact instructions with you. In the next slides, we will talk about the recovery process and what to do if you notice something concerning. To begin, let's talk about diet. You can eat a regular diet as tolerated. Avoid any foods that could cause problems, for example, greasy, spicy, or fatty foods. Though they may sound appetizing, they can cause stomach upset like nausea, vomiting, or bloating. It is also very important to drink plenty of fluids, especially water. This helps aid your body's recovery. No matter what type of birth you have, it is important to rest your pelvis afterward. This means nothing in the vagina for at least 6 weeks, which means no sexual intercourse, no douching. A douche is a bulb with an insertion device you place inside the vagina to cleanse internally and is generally not recommended. No tampon use. Once you are completely healed, you should be able to resume the use of tampons, but waiting until your postpartum check is important. No other items inserted into the vagina or the vaginal opening. No soaking, sitting in baths, hot tubs, pools, or open water like lakes or oceans. Remember, once you have your health care provider's approval, you can resume most activities safely. Vaginal bleeding is a normal part of the healing process after delivery. You will have vaginal bleeding and past clots. If you have the following symptoms, you should contact your doctor. Vaginal bleeding that is soaking 1 large postpartum or heavy flow pad in an hour for 2 or more hours straight. You have vaginal discharge that has a foul odor. Postpartum bleeding and discharge have a blood type smell, but if your discharge smells bad, you should contact your doctor. Constipation is difficulty having a bowel movement or going poop and can be common after delivery. Having constipation can be painful after cesarean deliveries. The opioid medications used during the surgery for pain control can worsen constipation. This is the reason we try to use other medications first to help manage pain. This is also why we gave you the pre-surgery drink. It helps to keep your stomach working. There are certain types of medications you can find at your local pharmacy or retailer that can help soften your stools and stimulate your digestive system. Colace, senadocosate, and Miralax are all commonly used. Remember that eating a high-fiber diet and drinking lots of fluids can also help, so keep drinking water. Depending on your health history, your doctor may recommend blood thinners after delivery. This would be based on your risk factors, and your provider would discuss this with you. Patients ask, "When will I go home?" If you are meeting your surgical milestones, we want you to be able to go home and recover in comfort. Most patients meet their surgical milestones and go home 2 to 4 days after their cesarean surgery. If for some reason you're not meeting your surgical milestones, we will not send you home. In rare cases, due to complications, patients may stay longer. If, after your discharge, your baby needs to be in the NICU, you can stay in your baby's room. We know it is safe for you to go home by looking at certain surgical milestones or indicators that tell us you are healing well. These surgical milestones include that your pain responds to oral medications or pills, you can walk or are resuming normal mobility, you can urinate, you can tolerate eating and drinking, you are passing gas, and your bleeding is controlled. When you can return to work is different for each person and each work situation. You may have already worked out a basic timeline with your employer. You should ask your provider when it is okay to go back to work. Your nurse can help you with the paperwork at your pre-operative appointment. After discharge, you should call the doctor if you have a fever greater than 100.4 Fahrenheit or 38 degrees Celsius, your pain is not helped with the pain medication you are taking, you have heavy vaginal bleeding. That means filling a postpartum or heavy flow pad in 1 hour for 2 or more hours in a row. You cannot tolerate eating or cannot keep food down due to vomiting. There is redness or drainage coming from or around your incision site, or you have abnormal or foul-smelling discharge from the vagina. You should call anytime you feel something isn't right. We are here for you. You may need to contact help after going home. My chart is great for non-urgent questions. If you need a faster response, we recommend calling your obstetric provider's office. For after-hours assistance, call Meriter Hospital at 608-417-6000 and ask for the OB/GYN resident. You can also contact your OB provider's office and ask to be connected to the provider on call. Always follow your care provider's instructions. Instructions can also be found on your AVS or after visit summary. For emergencies, go to urgent care or the emergency room, or if needed, call 911. Now that you have finished watching this video, we hope you can say, I understand how to use the wipes provided to me. I understand I can eat a regular diet until 8 hours before my scheduled cesarean. I understand I need to arrive at least 2.5 hours before my scheduled surgery. I understand after my surgery I will experience some pain. I understand that my pain will be mostly controlled with scheduled pain medication. I understand opioid or narcotic pain medications have side effects. I understand that my care team before, during, and after surgery will support me through my cesarean surgery and recovery. This video was created by physicians, nurses, administrators, educators, patient representatives, translators, and other health professionals who, as members of the organizations below, provide care at UnityPoint Health Meriter Hospital. This video was made possible by a research and educational grant from the UnityPoint Health Meriter Foundation.